Dr. Anthony Fauci says the new MOVE variant, that's MU, is being tracked by the World Health Organization, but it's not an immediate threat to the United States. WHO officials are calling the strain first detected in Colombia a variant of interest. They say it could be more vaccine resistant. The country, meanwhile, remains divided on mask mandates despite the rise in pediatric cases due to the Delta variant as schools reopen nationwide here in the United States. Manuel Bojorquez is in Florida with more.
For us, this is not about politics. This is truly about a pandemic.
Florida's governor banned mask mandates in school, but the state's second largest school district, Broward County, is pushing back, requiring masks in class unless a child has a medical exemption. So the state is following through on its threat to withhold funds equal to school board members' salaries, ignoring a judge's ruling that struck down the governor's ban.
Ultimately, when it comes down to students' well-being, I trust the parents more than I trust the government.
But doctors say trust the science, especially in light of the numbers. Children have made up about 15% of documented COVID cases in the U.S., but as of the end of August, the percentage has risen to above 22%.
They're getting infected from people who are unvaccinated. And so it's not your right as an American to catch and transmit a potentially fatal infection any more than it's your right to run through a stop sign at an intersection.
Dr. Paul Offit with Children's Hospital of Philadelphia says the approval process takes time, so a vaccine for kids under 12 may not be available until at least the end of the year.
Well, you want to make sure that you have done the studies in the right way, that most importantly show that this vaccine is safe, because you're about to put it into millions of children.
Catherine Perillou's 2-month-old son, Junior, is much too young for the vaccine or the battle he's fighting. He's been in intensive care in New Orleans for 3 weeks due to COVID.
He already had, respiratory issues. So when he caught the virus, it just doubled up and made things entirely worse.
She has this message.
I want everybody to realize is that, we have a virus out here that is impacting our children. And they are our future. And whatever we can do as a community to make sure that we protect our future, then we need to offer that to our parents out there.
So joining us now is Dr. Dyan Hes. She's the founder of Gramercy Pediatrics in New York City. Doctor, thanks for joining us. So we are learning, CBS News has learned, that Florida is going to be fining schools, businesses, and government entities that require proof of vaccination. Let me make sure I got that right. Yeah, proof of vaccination. It's going to be like a $5,000 fine. What do you make of that?
It just incredibly ignorant. I cannot believe. I used to like Ron DeSantis, Governor Ron DeSantis. I cannot believe how many people are misguided. This is not political. It is not your right to spread disease to other people. It is not your right to jeopardize my health or your health. It is your right to enjoy a free society where there are rules. That's why it's a democracy. There are rules. And Governor DeSantis has just really gone down a path, I think a really dangerous path, which is making science political. And he's really not basing his decisions in science. I think it's disgusting, and I think it's really going to hurt people who want to stay open but don't want non-vaccinated customers in their stores.
And of course, doctor, as pediatric cases surge across the U.S., give us a sense of what you're currently faced with in New York. In that story where we see that little baby, suffering, it broke my heart. No one should have to see a child that young in the hospital because of what we're currently facing as a country, as a planet. But what is your sense of what's happening here in New York?
Well, the cases are definitely up, but I'm not a hospitalist. I'm a pediatrician, a private practice pediatrician, and I have to be honest, we really haven't had very sick kids with COVID. And I've said this every week. I have never sent one patient to the hospital with COVID. I've never sent a patient for a chest x-ray, not even a blood test, or even a second visit, honestly. But that baby has respiratory issues. That baby is a high-risk baby, and that baby caught COVID, which could have been probably prevented if people around that baby were vaccinated. And that's extremely unfortunate. And we're going to see more and more cases like this of preemie babies, NICU babies, babies with congenital diseases, and our children with congenital diseases or chronic diseases that are more susceptible to COVID getting it because some of the adults are vaccinated and some aren't. And the ones who aren't are giving it to our children. And we're going to just see higher numbers. I think most of the kids in New York City were honestly exposed to COVID in March 2020 when we were the epicenter of the virus. And I think we have a lot of maybe a little bit more herd immunity than other states are having right now.
So that's going to, at least comfort some parents to hear you say that. But the truth of the matter is that we're seeing an uptick in pediatric cases. CDC Director Rochelle Walensky says that the Delta variant can spread. It spreads a little easier than the variants that came before it. So if you were to give parents some general advice when it comes to keeping their kids safe, what would you tell them?
Well, I still think school is best, masked in school, if you can tolerate the mask, and, for the younger kids, 2 and up, depending on your school guidelines. Definitely once you're school age, like kindergarten and up, they have to wear their mask in school. There are very few medical exemptions to not wear a mask. And most of those patients who have medical exemptions probably wouldn't be in school anyway, unless there's like a neurological impairment that they can't tolerate a mask. I would say do as many outdoor activities as you can. Take them to the park, playgrounds, while the weather is still good. I mean, Florida also has the advantage that it has good weather year round. So Ron DeSantis is not like impacting all of his constituents like, New York or the Northeast, excuse me, where it's going to be cold and raining really soon and we're going to be forced indoors again. So I would encourage parents, send your kids to school with a mask, keep them active. I actually did a home visit yesterday for a family who is terrified of COVID. They have a 1-year-old and they are afraid to go in the elevator because their building doesn't mandate that people have to wear the masks in the elevators. This child, excuse me, was so scared of me. He has really not seen people. He's 1-year-old. They are terrified. And he kind of lives in a bomb shelter. And I really encourage the parents to put like a plastic covering on his stroller, take him down in the elevator, get him to go to the park, take walks, maybe do an outdoor music class. I mean, we need these kids not to fall behind. We need them educated. We need them socialized. There are so many repercussions from staying home. So my biggest guidance would be like, get a good mask, practice with your kids at home, have them do art projects at home with a mask on, have them read a book with a mask on. So it's not new and scary when they go to school with it.
So Dr. Hes, let me ask a question. And Anne-Marie always jokes with me that I should write a book called I'm Not a Parent, But. Right?
I said that for many years.
Okay. All right.
Yeah, but at least you're a pediatrician, doctor. Vlad is like, I've got some parenting advice based on my observations.
Okay, so but this is a question that I've heard from many people, and because I'm jumping off the point that you were making, Dr. Hes, about what the effects of not being in school for children will do long term, what kind of detriment that they'll face in the years ahead. But I do have people that have suggested to me and have asked me, there are children around the world who do not have the infrastructure that the United States has. There are kids in countries that I've worked in that have to walk a mile to get to school. In other words, even with this infection and this pandemic, we are a very privileged society, the United States, compared to other countries. And kids in other parts of the world put up with so much just to be able to get to that classroom and to learn and to get an education. And there are some who will say to me, people that in the countries that I've worked in, and these are tough places to live, have said, if the worst thing is that a kid's got to wear a mask in class, or that maybe he's got to distance learn on a computer when we don't even have computers to do that, they'll be okay because the kids in other countries are also okay. They get an education and ultimately go on to do things. What do you say to that?
Yeah, I mean, I agree. We are a privileged first world country, and that's why we have vaccine refusers. You really don't see vaccine refusers in third world countries. I always say that. People walk with their children 9 miles strapped on their back to get a vaccine multiple times a year when it's offered because they know that will keep their kids alive. I would say that, education, whichever way you can get it, of course, is best. We are privileged that we have online schooling, but I still don't think online schooling is equivalent to going to a classroom and being socialized with other kids. I think that would be the last-ditch effort, and I think that's why New York City ultimately didn't give an option for backup online schooling because it really did not work. I have multiple patients who are repeating grades or moving out of state and repeating grades because they really did not learn online, especially if their parents weren't there to supervise. I know I made a deal with my son who's going to college that if it was going to be online this year, he was going to take a year off because he's just not a good online learner. And I think that our country is far too privileged. We don't realize exactly like what you said, like I saw you in Haiti, 2 weeks ago. Those kids would do anything to go to school and anything to get an education. And you know what? Wearing a mask or wearing a bandana, if you don't have a mask in a poor country and it gives you the option to get an education, that should be priority number one.
Listen, Doctor, we sort of teased this segment by talking about the World Health Organization warning about a new variant called the MU variant, MU, discovered in Colombia. The warning is that it could be more resistant to vaccines. Dr. Anthony Fauci says that there's no imminent threat to the U.S., but what should we know about this new variant? Once upon a time, the Delta variant was something that was happening all the way over in India, and now it's our primary problem.
I don't know much about it. I just know that it's not surprising to me because viruses mutate, and this virus has been a real pain in the butt with mutations, and we're just going to see more and more of it, and we have to stay ahead of the science. And that's why, I always say, like, everybody's like, oh, we have the vaccine and we're done. We're not done. I mean, I'm sure Pfizer and Moderna and other drug companies are working to improve their vaccine to cover more of these variants. We have to be one step ahead of this virus, and we've always been one step behind. So, I mean, it's too soon to tell. And I still believe, kind of like if you make an analogy to the flu vaccine, the same thing. Like, it might not work for every strain of the flu that year, but if you get the flu vaccine, you're not going to end up in the hospital. And that's exactly what we're seeing with the COVID vaccine. You might still get COVID, and there are breakthrough cases, but you are not loading up our hospitals. I mean, I just want people to think who are anti-vaccine, if you have a car accident and you need an ICU bed and you're in a state like Louisiana or Texas or Florida where there are no ICU beds, you are not going to be treated. You are going to die waiting for a bed. Get your vaccine so the hospitals can go back to doing real medicine.
All right, Dr. Dyan Hes, thank you very much as always for your insight and analysis. We appreciate it. Have a nice weekend.
You too. Bye-bye.